Hello everyone, we are a couple of joints. I'm Deepti Challa and I'm a rheumatologist.
And I'm Dr. Shiva Challa, an orthopedic surgeon.
And here we are for all your joint related questions.
So, most of my colleagues and everyone were disappointed with the information that you'd given me last time. So, is there any good news when it comes to smoking for any of these guys who just don't want to drink and maybe do an occasional smoke here and there?
So Shiva, coming to smoking, smoking is considered to be the worst habit as far as rheumatology or any rheumatological arthritis are concerned. So when you look at smokers, smokers tend to have 2 times more joint problems and 2 times more inflammation than normal individuals. And smokers tend to need more drugs and higher doses of the drugs than a person who has the same disease but does not smoke. So I would say smoking is the worst habit anybody can have, and even the one odd cigarette occasionally or socially can be quite troublesome for your joints.
There is a particular reason why I asked you that particular question, because inflammation wise smoking always has its own consequences, but most of my patients who've had trauma to their extremities and they've actually had a surgery, they come up to me and say, I'm going to lie on the bed for the next 6 weeks. Can I consume either alcohol or smoke? And which one is worse? In that particular situation, I say both are bad for you, but if you compare both, smoking is actually the worst. The reason being, there is a slower healing of your bone. The fracture doesn't heal. There is a higher chance of non-union, which we call it. The surgery sometimes goes for a waste or a toss. There are higher chances that your wound can get infected. So smoking itself, you cannot consider it as a positive thing in any aspect just for the fact that you sit lying on the bed for 6 weeks just because you had a fracture. So that's from my point of view. So smoking as such is a deterrent for any fracture, any forms of fracture healing. So coming back to you, anything else you want to elaborate on smoking aspect and arthritis, the relation and the link between these?
Yes, so we all know that when you smoke there is a significant damage to your lungs, but what we don't know is when you smoke, it triggers an inflammation in your lungs. So basically we have amino acid called arginine, and this arginine is converted to another amino acid called citrulline. So this is called citrullination. This occurs in your lungs and it also occurs in your joints. So whenever you smoke, this particular citrullination occurs, and this causes or this ends up triggering an previously non-existent arthritis. So this is how smoking affects your lungs and affects your joints. Also, we need to note, whenever you smoke, you don't have too much of a good oral hygiene. You tend to have a lot of gum diseases, and these gum diseases itself can trigger rheumatoid arthritis. So yes, rightfully said, not only from an orthopedic point of view, but even from a rheumatology point of view, smoking has to be stopped. Smoking is literally the worst habit that anybody can have.
So most of the smokers actually brush their teeth or put tulsi leaves before going home, but I don't think it protects you from your joints or any other form of medical issues that might crop up in future. So can I ask you, now that the next generation is actually more aware about all these consequences, they're now moved to vaping?
Yes.
And I'm not really aware about what exactly vaping is, but is it a very good alternative to smoking? That's something I wanted to ask you, if you do know about vaping.
So this is a question most of my younger patients do ask me, can I switch to vaping? Can I switch to e-cigarettes? And some of them are, can I switch to nicotine-free e-cigarettes, or a new so-called herbal cigarettes where they say they have clove cigarettes, cardamom cigarettes. But let me point out that any form of smoking, be it vaping, e-cigarettes, nicotine-free products or herbal cigarettes, they all end up causing oxidative damage. That is, they release something called free radicals into your blood, and that itself triggers a lot of inflammation. So no, there is no good form of smoking. Absolute smoking cessation is a must. Doesn't matter if you're smoking a cigarette or a BD, or doesn't matter if it is an e-cigarette, vaping, nicotine-free products, everything has to go. And not just the smoking part of things. I have a lot of patients who are consuming nicotine gums, nicotine patches, they also have to go, because nicotine also is not good for your joints. So you have to tell all the patients that there should be complete cessation of smoking, all forms of smoking and all forms of nicotine. So as we previously discussed in the previous video, there is moderation of alcohol, there is no moderation of smoking. Smoking has to go.
Not even one a day.
Not even one in your life.
That's a very good point. Point well taken. So I was actually hoping for one cigarette a day, but you actually have now condemned it to a lifetime. So
see, again, Shiva, I'd like to point out something. One cigarette a day might look like it's nothing, but what we look at is something called pack years. So it basically depends how many cigarettes you've smoked for how many years. So I have patients who tell me, oh, I've smoked only for 2 years, but I've done 20 a day. And some people come and tell me, I've smoked for 20 years, but I've just done 1 a day. It doesn't matter the quantity or the quality, smoking has to go. So I hope I have disappointed all of you and I'm please scared you all. Please remember, smoking is not a good habit for anybody, especially patients who have arthritis. Smoking not only makes your joints worse, but it also doesn't let our medications do the work. So I tell all my patients, and I'm going to tell you too, please stop smoking.
especially when you have arthritis or any form of fracture which is yet to heal, kindly keep away from smoking.